Hello everyone, in today's session we'll be learning about the muscles of the anterior compartment as well as lateral compartment of the leg through the anatomy decoded notes. Okay, in the previous sessions we had covered up to the muscles of the thigh region. Okay, and in the last video we had also covered the popliteal fossa, very important topic asked in theory exams. Okay, so muscles of the anterior compartment of the leg, where are they located? Can you all identify the site where are they present? Okay, here we can see the right-sided lower limb viewed from the anterior aspect. This is the region of anterior compartment of the leg, and on the lateral aspect there is the lateral compartment of the leg. Okay, so muscles in the anterior as well as lateral compartment, total number of muscles are mentioned here. Okay, in the anterior compartment there are 4 muscles, in the lateral compartment there are 2 muscles. Okay, in the previous videos we have covered all these muscles. Make sure you all watch those videos if in case you have not seen yet. Okay, so let's begin with the anterior compartment first. So here we can see a schematic image showing the muscles of the anterior compartment of the leg. Okay, the first muscle that we'll be learning is this, the tibialis anterior muscle. Okay, this is the tibia bone, a muscle present lateral to the tibia. Okay, on the lateral surface of the tibia this muscle is present, tibialis anterior. Okay, then there is a muscle to the toes. Okay, that muscle is referred to as extensor digitorum longus. Then there is a muscle to the great toe, that is the extensor hallucis longus. Okay, and there is one muscle called as fibularis tertius. Okay, all these are the muscles in the anterior compartment of the leg. Okay, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and fibularis tertius. Okay, these are the 4 muscles. And muscles in the lateral compartment of the leg, we are looking in a lateral view. Okay, there are 2 muscles, fibularis longus muscle and fibularis brevis muscle. Okay, so a brief overview of the location of these muscles are clear. Now we'll study these muscles with the standard headings. Those are the origin, insertion, nerve supply, and actions. Okay, so tibialis anterior, origin is from the lateral surface of the tibia and the adjacent interosseous membrane. Okay, and insertion, it is going up to the inferomedial aspect of the medial cuneiform and base of first metatarsal. Okay, try to identify the muscle here. This muscle is tibialis anterior. It will go up to the medial aspect of the base of first metatarsal and medial cuneiform. Then nerve supply is deep fibular nerve, and action is dorsiflexion of the foot at the ankle joint, inversion of the foot, as well as it supports the medial longitudinal arch of the foot. Okay, this deep fibular nerve, it is a branch from the common fibular nerve, and it is the same nerve which supplies other anterior compartment muscles. Okay, all anterior compartment muscles are supplied by deep fibular nerve. This nerve is also referred to as deep peroneal nerve. Okay, then next muscle is extensor digitorum longus muscle, arises from the proximal half of medial surface of the fibula. Okay, so note amongst the 4 muscles in anterior compartment, 3 muscles are arising from fibula: extensor digitorum longus, extensor hallucis longus, and fibularis tertius. All 3 are arising from the fibula. Only this tibialis anterior is arising from the tibia. Okay, so proximal half of medial surface of fibula is the origin for extensor digitorum longus. Insertion, it goes up to the dorsal digital expansion, and then it goes up to the base of the distal and the middle phalanges of the lateral 4 toes. Okay, nerve supply is deep fibular nerve. Action is extension of the lateral 4 toes and dorsiflexion of the foot. Okay, then extensor hallucis longus, arising from the middle half of the medial surface of fibula and the adjacent interosseous membrane. Insertion, it goes up to the distal phalanx of the great toe. Nerve supply is deep fibular nerve. Action will be extension of the great toe and dorsiflexion of the foot. Okay, the next muscle is fibularis tertius, arising from the distal part of medial surface of the fibula. Insertion, it is going up to the base of the fifth metatarsal, okay, on the dorsomedial aspect of fifth metatarsal base. Now supplies deep fibular nerve. Action is dorsiflexion and eversion of the foot, because this fifth metatarsal is present on the lateral aspect, okay. So contraction of this muscle can cause eversion of the foot, okay. Let's try to identify these muscles here. Tibialis anterior we had identified, okay. Then this number 2 muscle is extensor digitorum longus, going up to the lateral four toes. Then number 3 muscle is extensor hallucis longus, going to the great toe. Then number 4, the muscle is fibularis tertius. Okay. So all these muscles are having one common action if you see carefully, that's the dorsiflexion of the foot at the ankle joint. Okay, all muscles are causing dorsiflexion. That means when the foot is raised, okay, when the dorsum of the foot is raised, that action is referred to as dorsiflexion. Okay, when the foot goes down, that movement is referred to as plantar flexion. That movement will be caused by posterior compartment muscles. Okay, now let's cover the muscles of the lateral compartment of the leg. Okay, so those are fibularis longus and fibularis brevis. Okay, also referred to as peroneus longus and peroneus brevis. Okay, peroneus is an old word, fibularis is the new word which is used in standard textbooks. Okay, then fibularis longus arises from the upper lateral surface of the fibula as well as from the head of the fibula. Insertion, it is going up to the inferolateral aspect of medial cuneiform and base of first metatarsal. Okay, if you carefully see, this attachment is for the tibialis anterior as well. Tibialis anterior is also going up to the medial cuneiform and the first metatarsal, but the region is different. Okay, for tibialis anterior it is inferomedial part. For fibularis longus it is inferolateral part. Okay, so basically the muscle which is present on the lateral aspect, that muscle will cross the sole of the foot from lateral to medial aspect. Okay, and it will go towards the medial bone. Okay, so this number 5, the muscle is fibularis longus. Okay, it is present on the lateral aspect. It will cross the sole of the foot from lateral to the medial aspect, and then it will get attached onto the first metatarsal, okay, as well as medial cuneiform. Nerve supply here is superficial fibular nerve, and action is eversion of the foot as well as plantar flexion of the foot, and it also supports the arches of the foot. The next muscle is fibularis brevis muscle. It arises from the lower two-thirds of the lateral surface of the shaft of fibula. Insertion is on the lateral tubercle at the fifth metatarsal bone. Nerve supply is superficial fibular nerve, and action is eversion of the foot. Eversion is a moment in which the lateral border of the foot is raised. Okay, when the lateral border is elevated, that moment is eversion. Okay, both fibularis longus and fibularis brevis, they are causing eversion of the foot. Okay, now let's read about the applied anatomy. So applied anatomy, if you see first, it's mentioned as foot drop. Okay, what is foot drop? It is plantar flexion of the foot which occurs due to the paralysis of the muscles of the anterior compartment of the leg. Okay, normal action of the muscles of anterior compartment of the leg is dorsiflexion. Okay, that means the foot is raised up. Okay, so if these muscles get paralyzed, the foot goes in plantar flexion. Okay, and the patient walks in a specific gait that is referred to as high steppage gait. Okay, so why does this happen? Due to the injury of the common fibular nerve. Okay, common fibular nerve further divides into superficial fibular, deep fibular. Okay, and this common fibular nerve is vulnerable to injury when it winds around the neck of the fibula. Okay, at this site it may get injured by direct trauma, fracture of the neck of the fibula, or a tightly applied plaster cast. Okay, so this foot drop separately is also asked as a short note for you all, where you're supposed to write about the muscles of the anterior compartment of the leg, its nerve supply, and the paralysis will lead to the condition called as foot drop. Okay, then there is a condition called as compartment syndrome, also referred to as shin splints. Okay, what is this? the muscles of the anterior compartment of the leg, they lie in a very tight compartment. Okay, the deep fascia which covers this muscle, it is quite stretched out and there is a very little space available in the compartment. Okay, so if there is a sudden overuse of the muscles of the anterior compartment of the leg, it may lead to blockage of the venous blood which is returning back. Okay, so that leads to more pressure inside the anterior compartment that can compress the anterior tibial artery. Okay, which can reduce the blood supply to the muscles, leading to ischemia and pain. Okay, this condition is referred to as compartment syndrome. Then there is an applied anatomy related to the lateral compartment of the leg muscles. There could be loss of eversion of the foot when there is paralysis of fibularis longus and fibularis brevis. Okay, basically when the common fibular nerve, if it is injured at the neck of the fibula, it can lead to loss of eversion of the foot as well. Okay, because the same nerve divides into superficial fibular nerve and the deep fibular nerve. Okay, so try to identify the muscles here. This number 5 muscle is fibularis longus muscle and this number 6 muscle is fibularis brevis muscle. Okay, fibularis brevis muscle is present in the lower 2/3 part. Okay, so like this you need to remember the origin, insertion, nerve supply, action and identification in the cadaveric image is also mentioned in these notes. Okay, make sure you all access these notes from the link which is given in the description box below, or else you all can scan this QR code as well. Okay, thank you.